Thank you for joining us today for this important discussion. I'm Megan Hunter. I'm the President and CEO of the Morris County Chamber of Commerce and Economic Development Corporation. I'm excited to kick off this senior series with our leaders of our hospitals and healthcare institutions within the county. These institutions make Morris County an extraordinary place to live, work, and to play. Their excellence and commitment to excellence has made Morris County a premier county in our country. So we thank them for all that they do day in and day out, especially during this pandemic. Senior care, as we know, our population is aging and is as important as it ever was, if not more so. And in Morris County, we do see an increase in this industry sector, healthcare, senior care, and it's also a testament to the county's commitment to caring for our senior population. So we thank you again for joining us today, and I look forward to this important conversation. First, before I hand it over, I would like to thank our staff, in particular, Ms. Wendy Long, who is our Director of Member Relations. Wendy, thank you for coordinating this. I know everyone on this panel has extraordinarily busy schedules, so thank you for all of your efforts in putting this together. Of course, we are grateful for all of those on the panel for being committed members of the Chamber and for making our organization such a premier chamber that it is. So we thank them for being with us today and again, talking about this very important topic. Our mission at the Chamber remains to connect, to convene, to inform, to facilitate, and to advocate on your behalf. Our mission is your success. Of course, we are now doing that virtually. So I do encourage everyone to please visit our website, to log into our YouTube channel, to speak with Wendy Long about how you can maximize your membership with the Chamber. And of course, please check your inbox for all of the great information that our staff and our team has been sending your way, and about all the wonderful things that our members are doing that can benefit you and your business and your organization. So I think I can wish you all still a Happy New Year. And on behalf of the Chamber, I wish you all a healthy, happy and prosperous 2021. I look forward to seeing you on Zoom, and thanks to the vaccine rollout, hopefully in person before too long. So thank you, and I'll turn it over to Wendy Long.
Great, thank you, Megan, and thank you to this powerhouse panel. I really appreciate your time. We're calling this series Perspectives on Senior Living, and it's really a monthly series that we'll do throughout the year on helping people how to age well. Most of us at one time or another will have a senior in our lives that we are either helping, and it can be rather overwhelming. Until you're in it, you don't really realize what a maze it is to travel through. So this series is really meant to help educate in order for all of us to understand how best we can care for our loved ones and really support them in aging well. It's really knowledge. Like, knowledge is king here, I think, king or queen. And I really look forward to hearing from everyone on the panel. I've known Tim Hodges for many years now. He's worked in the healthcare industry for 30 years, specializing in senior housing and post-acute care. I'm thrilled that he's joined the Chamber, and he's currently serving as a strategic advisor and a freelance writer, focusing on the elder healthcare sector, which of course he is really known as an expert to many of us in this space. So thank you, Tim, for moderating this important topic, and thank you to the panel, and take it away. I'm really looking forward to this discussion.
Okay, thanks, Wendy. Thanks, Megan. Good afternoon, everyone. Really excited to be with our extremely dynamic panel, and I echo Megan's sentiment. Wendy, amazing job putting this together. So as we're actively managing a second wave of the coronavirus pandemic, coupled with the rollout of the COVID vaccine, as Megan mentioned, the timing really couldn't be better for today's town hall. The purpose, idea, and goal of today's town hall really is to educate attendees on the senior services and resources which are abundant in Morris County, and try to come together for the hour that we have as a healthcare community to provide a broader perspective on how healthcare providers positively impact the care of our aging population. We'll also discuss how our healthcare system in Morris County is faring now, and a little bit of lessons learned from the past year and where our esteemed panelists think we are headed. And wow, what a panel do we have. Representing this continuum as panelists today is a dynamic group of well-respected and highly experienced panelists that I'd like to introduce. I'd like to first start with Trish O'Keefe. Trish is, as many of you know, president of Morristown Memorial Hospital. She enjoys an amazing reputation for care and part of the Atlantic Health System. Trish, thank you so much.
Thank you.
Brian Feinstein, who is the CEO of St. Clare's Health in Denville and part of a larger health system called Prime Healthcare throughout New Jersey and the country, actually. And then Ben Kurland, who is the CEO of Allaire Health Services, who operates multiple senior care centers in the Mid-Atlantic region and right here in our own backyard in Morris County, 2 very well-regarded facilities. And then Ryan Astro, who is the president of Boonton Care Center, which is also a senior care center that is in Boonton, New Jersey, Morris County. So welcome to you all. We've reserved for the attendees about 10 minutes at the end of the presentation for questions and answer from the attendees. So please submit your questions as we go along. And then finally, on behalf of the Morris Chamber and the entire community, I'd like to echo the earlier sentiments and thank all the panelists and your respective organizations, and of course your team members. I think hero can never be a cliche as it relates to what everyone and your teams have done on this panel in the past year. So a big thanks from all of us. Okay, so since this is the kickoff series in the aging series for the Chamber, I'd like to start with Trish, if you would, and then Brian on a question related to caregiving, which is its own sort of pandemic, so to speak, in the United States. So according to the National Alliance for Caregiving, which is a national advocacy group based out of Washington, D.C., close to 30% of the US population is providing some amount of time caregiving for an elderly loved one. I don't think a surprise to anyone. I know both of your institutions offer services related to caregiver information and education. Trish, perhaps you can kick things off by sharing your thoughts on caregiver stress and the importance of seeking out support when caring for an aging loved one, which is equally trying during this pandemic for sure.
Mm-hmm. Well, thank you, Tim. It's a privilege to be here today, and with my wonderful esteemed colleagues as well too. So as we all know, the silver tsunami has truly hit us and will continue to hit us over the next couple of years, and we need to support this very important population of our aging, healthy community, but also balancing from the caregiver's perspective. You know, many of us and many of our communities are truly not prepared from a fiscally perspective standpoint, mentally as well as physical standpoint on caring for our aging population. So there are numerous studies that have shown that not addressing the needs of the caregiver, actually the caregiver ends up sometimes more ill than the patient that you're caring for. So what we're focusing on is really supporting the caregiver in balancing their life and what their needs are. Clearly, part of it is really educating that population on truly how to basic needs, what are the basic needs of that particular patient that they're caring for. So we've been offering throughout the community, actually a virtual series, as we're all living virtually these days, right? Virtual series to support the caregivers on the basic needs, basic training of how do you care for your loved one in your home, but also offering them particular resources that are multiple out in our communities. We have a geriatric assessment center that is supporting the patient as well as the caregiver on the changes that they're seeing with their loved one, whether cognitive, whether physical, and how do you work on a short-term and long-term plan to really have a plan in place for them. We're also offering a particular caregiver training lab, which we're not used to it, right? Through our life, we go through our day-to-day, but really how do you basically understand what are the needs of our aging population from a physical perspective? So we really sit down with an aide, with a social worker, and work on that plan with the caregiver and meeting the needs and continuing to support.
That's excellent. It's very innovative. Brian, do you have thoughts? And what is your opinion?
I'll try and complement some of what Tricia said. Thanks, Tim. So clearly, you know, the COVID pandemic has been stressful for everyone. There's been, you know, strong emotional reactions can be the result of fear and anxiety because you really don't know what the potential impact of the virus is. We've done the social distancing, and that can make people feel isolated, lonely, depressed, and it creates increased stress and fatigue that can affect the caregiver. And if I can digress for a second, in March, I was in a meeting with about 12 people. Now, I'm not in the high-risk group, but back in March, about 9 of the 12 of us came down with COVID. So people on either side of me, and I was lucky that it bypassed me, but I was isolated for 5 days. So the testing, family was staying clear. Again, the unknown of what to expect. And me as the, you know, in this case, the potential patient, I really did feel very much alone. So caregivers are challenged with keeping care of themselves as well as the people that, you know, their loved ones that are put in their charge. And we need to stay grounded. So, you know, you want to make sure that we're connecting with people that we can rely on so that, you know, as difficult emotional issues are arising, we have someone we can lean on. I think that there's the online, social media, phone communications should all be considered. Again, in taking care of yourself, healthy diet, exercise, relax time. So I think they're important. And I think the other theme is for both the caregiver and the patient, to the extent that you can create a daily routine, I think that can help in terms of assuaging any potential stress. Obviously, that's at a lot of times that's easier said than done. So also at St. Clare's, we do have our wellness and recovery, which is sort of a urgent care for those people who have issues and need to reach out. We have a psychiatric emergency service. It's the, you know, Morris County Screening Center. So for people who have, you know, emergency needs, the resources are there. And like Trish outlined for Atlantic, we also put out a streaming series. And actually on Thursday, Dr. Singh is going to be online for us in Facebook talking about behavioral health issues. So he's going to be covering what we're trying to do briefly in a 15-20 minute segment. So I think we've all spent a lot of time gearing up. And as Trish again said, we saw it in the spring, it led up over the summer, and now we've seen the surge, and we're there trying to support each other. And it's no different for the caregiver at home. So I think that is as much perspective as I can give it, Tim.
Thank you. I appreciate that. A really quick follow-up. You know, the crux of my experience is in Alzheimer's and dementia care, and oftentimes we see that typically the spouse of the person living with memory impairment, sometimes the toll physically could be as significant as the cognitive impairment of their spouse. But I know both, I don't think people realize if they should need hospitalization, you know, there's an elderly couple, you both offer social services departments. Can you maybe talk a little bit about how they intervene and get involved in the disciplinary team when a patient is admitted and may need to have other resources identified for them, Trish?
Sure, Tim. If the patient ends up and comes to our emergency department as well, we do have a geriatric nurse practitioner who really coordinates that multidisciplinary plan of care with our geriatricians. We have 4 geriatricians in the hospital right now, have an outpatient and inpatient support, and again, working closely with our geriatric assessment center as well as the healthy aging program to offer additional resources. Another area that many of the hospitals in the area, and particularly Atlantic, have embraced the niche program, and that's nursing enhancement of healthcare elderly in healthcare settings. So that really has a unique focus and awareness for all staff members that care for our aging population wherever the patients are located. So really that enhancement, that special touch that's needed.
That's fantastic. And I applaud both of your institutions for offering those resources, especially the streaming. I actually didn't know that. And for the attendees to today's conference, that might be a good resource if you're caring likely for or a practitioner caring for an elderly population. What a nice resource to offer people who are still, you know, shut in or afraid to go out. Thank you. Ben, if I could ask you regarding elder care, your nursing homes, post-acute care facilities, subacute, there's so many different terms for our industry now, but they provide short-term care and long-term care and other specialized services. But for our attendees, can you explain the difference between long-term care and post-acute care and the services that you offer at your locations, please?
Absolutely. So first of all, it's a pleasure to be here. Thank you. I do want to take this moment to applaud my colleagues on the call for, I'm not sure if all of you know that Morris County is one of the healthiest counties in the country. And I think that's a large part to you on this call and the institutions that you have in this county. And Morris County is better off because of it. So Tim, it's also a pleasure to be here and to connect with you as well. To go to your question, I think there's definitely a lot of confusion because of the verbiage that's out there and rhetoric as far as what you're calling it. So really, just to keep it simple, most nursing homes in the country have 2 components. They have the long-term care side and they have the short-term side. Short-term is really an extension of the hospital, which what we'll refer to as post-acute. And now that has changed over time. I mean, they used to say like every couple of years it changes. Now I think it's every couple of weeks, and I think COVID has definitely accelerated that. So the short term is if somebody has an acute episode, whether it's a cardiac event, respiratory, something that requires a hospitalization, and then they need follow-up care. That's when they would go to a quote-unquote subacute or post-acute. Long-term care is more of a function of the person can no longer care for themselves. They need the assistance. Rule of thumb is out of the 6 activities of daily living, which are eating, bathing, toileting, dressing, etc., they can't take care of 3 of those themselves. That would, from a rule of thumb standpoint, they would need long-term care. And different facilities focus on different things. As a company that has the 2 largest facilities in Morris County, we have our Morristown post-acute facility, which is directly across from Morristown Hospital, and our Morrisview Healthcare Center, which is more in the Morris Plains area. Our Morristown post-acute, which we figured that's something that we're going to focus on, is on the post-acute side, being the extension of the hospital, where we have that transitional care type feel. We have the constant physician presence. We have the private suites, which oftentimes requires patients in isolation. And not even nowadays, which COVID, it's basically a requirement to have isolation, but oftentimes if it's respiratory patient, you want to keep the patient isolated. cardiology services, having cardiologists come in and out of the building, cardiac telemetry, remote patient monitoring, regular telemedicine. All these things are things that from a patient standpoint comes in after the hospital with high acuity levels, and they need that extra level of services. So while we do it in both of our buildings, I would say our Morristown post-acute focuses more on the subacute, and definitely a significant population will after that episode can no longer live at home. A loved one can no longer take care of them, so they will stay. Whereas our Morrisview Healthcare Center, which is also a highly rated facility, but because of its it's nestled out there, and it's large private rooms and things like that, lends more towards senior living where people could call at home. So that's really the two kind of things that would fit under our license, and different facilities, like I said, focus on different areas.
That's great. That's very helpful. Thanks, Ben. And I think working in Morris County for, about 30 years, I think it just dawned on me, I think we take for granted, it's one of the few counties that actually offers virtually every level of care, both acute care and, after hospital care. So you have, I think, Brian, you have a long-term acute care hospital affiliated with your system. Trish, you have an acute rehab hospital. I know that, I think recently opened in the past couple of years. Certainly home care. And then, of course, the post-acute care services. That is not, and then ventilator care. I think St. Clare's offers at the Dover campus. So, we're very lucky that people, healthcare is all about support from family as well. So it's very nice that people can stay local and visit their loved ones and don't have to travel further away, which is really the norm in most of the other markets that I've operated in. So I think to dovetail that concept, Ryan, talking about the complete healthcare continuum, I think COVID must have really underscored the importance to you as a senior care operator of collaborating with with all of those levels of care. Can you shed some light on how you're doing that and the importance of that, not only in COVID, but in general, to support the holistic needs of the aging population in Morris County?
Absolutely. So thank you very much for having me as well. I really appreciate being elected to work with these esteemed colleagues of mine here. It's quite the group you've put together. Kudos to Wendy and Tim for everything you've been doing. So to answer your question, Tim, the pandemic obviously has equally affected all of us in the same capacities. It has limited the ability to provide care to the population, especially the elderly population that we're predominantly serving here. And it has made the continuum of quality of care even more essential than ever before. By each group, whether it's a hospice organization, the hospitals, a nursing home, a home health institution, everybody's needed to coordinate with one another during these times because everyone's been shorthanded. COVID has obviously come out of nowhere. It's not something any of us have ever seen before. And everyone has needed to work together to be able to communicate continuum of care, obviously. If the physicians are communicating with one another, if the hospitals, the nursing homes, everyone is communicating with one another, then there is a much stronger quality of care result. There is less, it's more cost effective to operate that way. But more importantly, it brought everyone together. Whether you want to be together or not, we've needed to embrace technology. And each one of these groups has kind of needed to come, onto the same platform and find a way to communicate with one another so that we can serve the community from all disciplines levels.
I agree. Thank you. That was a great answer. I think, we're going to talk about silver linings in a couple of seconds, but it's really been kind of inspirational to see how people have come together and supported one another and sort of broken down those silos, excuse me, for the betterment of the community. And I think we all hope and feel that that's going to stick from this period moving forward. Now, I'd like to transition into the COVID arena for a second, because there's so much stress and negativity around the healthcare system as it relates to COVID. But there's so many silver linings, as I just mentioned. So I'd like to kind of do a round robin. Maybe we can start again with Trish, and if you could kindly share some of the silver linings in healthcare from your organization that have impacted operations that you think will stick over the long term. I think that would be very helpful for people to hear the positive side of the equation.
Sure,
Trish.
sure, Tim. A couple of things. Telehealth clearly has been embraced across Atlantic, and I know across healthcare. In our heightened first surge, we were seeing over 80% of our patient population from a physician practice perspective through telehealth. So it is here to stay. It will continue to grow, especially our elderly population who are quite scared to come into physician practices and such. I think the option of Zoom and Team, like we're doing right now, I think has expanded as well and will continue. There's some great efficiency from that perspective and not having to drive to meetings. I'm sure we're all in agreement across the panel as well too. But also the connectivity of the inpatient with their family members and offering Zoom and Teams to our patients. We purchased over 300 iPads over the last year. So we were celebrating weddings, birthdays, with the patient and their loved ones when they were here in the hospital. So some real opportunity there. And finally, we've created a COVID recovery center. As we know, we are not going to eradicate COVID. We hope we'll be decreasing COVID, but to be able to offer that support to patients, short-term and long-term, dealing with the effects of this terrible disease. So that's a very positive center that we feel that's been able to access for our communities.
Wow, that's really innovative, Tricia. Is that a physical location, or is it something can be accessed elsewhere as well?
It's a physical location, but also can be accessed virtually with our medical staff, pulmonologist, social worker, and other support. So yes.
That's exciting. Thank you. Brian?
We're seeing a lot of the same positives that Tricia's outlined. And I guess I feel very strongly about the patient being able to connect with their family members, particularly as we have visitation very, very limited. So whether it's the telehealth, Skype, it's making us take a hard look at technology to say, this wasn't the way we had done it before, but we're doing it now. More concretely, we do have a big behavioral health program, and we believe that COVID, if there is a silver lining, has helped reduce the stigma of behavioral health issues that people may have, because they are, as I said earlier, they're seeking additional help because they feel unprepared to deal with issues that they've never seen before. So we're really happy about that. Operationally, we have a COVID task force that meets regularly, and we make sure that underlining that as patients and families and physicians need help, we're anticipating those type of questions that someone may have heard of, may come up with on themselves. So we're ready to jump in, and we're using that task force model more and more. So it's not just about COVID. There are other new programs or developing programs that we want to make sure we're making more solid headway and that we're listening. So, it started off early on. We had these COVID task force meetings, and they were, lengthy, and we really weren't sure what type of direction. And now we have it. It's very specific. And I think it's giving people, more of an opportunity to raise issues, and we can maybe make some headway. So it's meetings, and it's about most importantly, removing that BH stigma.
They're saying in some of the media reports that COVID has accelerated technology, by 3 or 4 years and 6 months. Do you think that's a fair characterization of the acute care environment as well?
Very much so. And again, it goes back to, the telehealth that Trish and I are using quite a bit. We weren't that far along, and now it is here to stay. And, we're looking for other avenues that we can take advantage of. So absolutely.
Has COVID strengthened, for lack of a better word, the culture or the teamwork within your institutions? I would imagine it must have, right?
Very much so. Again, there are small teams and big teams that are working together, and you're developing relationships.
Okay, great. Ryan, would you care to join in? What are your
Sure,
silver
sure.
linings and takeaways?
Well, I mean, first, the heroes. I mean, oh my God, the staff was unbelievable during this time period. I mean, you know, for putting themselves on the line, coming in every day, working multiple shifts, basically living at the facility, trying to make sure that we don't have any shortages, that patients don't have any, you know, any needs that are gone unattended. I mean, wow, the kudos to all the healthcare workers and the frontline workers that really stepped up and put their lives at risk here without any vaccinations or anything like that. I mean, that's the biggest silver lining is, I mean, you just got to really see the best sides of people and sometimes the worst sides, but we'll focus on the best sides of people in this particular case. We really couldn't have done it without them. So that's obviously been the biggest silver lining. And then as both of my colleagues have alluded to, is technology and communication that has advanced tremendously. I mean, communication was the forefront for COVID as far as we were concerned here at Boonton Care Center. I mean, you know, as soon as this this pandemic broke and everybody was trying to figure out whether their loved ones, you know, were having any symptoms or what was going on, and the phone lines were constantly ringing, and, you know, nurses who don't have, you know, the time to necessarily answer every single family's call at every single moment, and as, you know, people are feeling that things are going unanswered, we immediately instituted technology. Immediately, we went out, bought out before any grants were done, purchased a number of iPads, made sure that FaceTime was available to all families, started a concierge program, had concierge workers working with the families, with the patients, with the staff members, so that we had just a complete, you know, massive communication. You know, there was no holes, no breakthrough. The families knew up to the minute what was going on. You know, I could talk about it a little bit more later, but we worked with an app called Serenity, which is an app that helps bring together caregivers and families. Each resident has their own page, and the families can ask direct questions. Our, you know, recreation workers would post, you know, daily pictures, would post, you know, each, you know, what's going on of the ongoings of the patients, and the families were able to get the information that they needed through the app. So between our first responder heroes and communication, I would say that would be, you know, our feelings on this.
Terrific. Great. I'm going to check that out. Serenity. Thank you. Ben, I saw a lot of the social media your company did over the past few months, and I have to, you know, give you kudos for, you know, rolling up your sleeves. You're always front and center on the front line. So great job there. What is your thoughts on silver linings for your organization?
Sure. Thank you, Tim. I think, you know, when thinking about COVID, I think, you know, there's going to be long after COVID is, I mean, like Trish said, it's never going to go away, but I think there's going to be a lot of soul searching. And I think people will view COVID more as an accelerant than a change agent. Things that were in the works, but perhaps were not front and center, got prioritized, got moved to front and center. You talk about communication. I think communication on all levels, both internal, external, were just 180 degrees. I mean, we had, you know, fellow nursing home operators, companies that, you know, probably, you know, would not have spoken, or, you know, it's proprietary or things like that. There was, you know, group chats between all the facilities in New Jersey, there's a national chat. I mean, just, we do pride ourselves in really good communication, both upstream, downstream, but I think Trish could speak to the fact that we were on the phone multiple times a day, multiple emails. You know, before COVID became even a thing, we were opening up a COVID unit. We were figuring how to do it. Let's make it let's do it, and then let's figure out how to make sure it's the best possible thing. So we knew that we could be a reliable partner, and the key to really overcoming a national pandemic is everybody had to come together. I mean, you talk about, you know, position pivots. I personally became a CNA. I encouraged our other staff, administration, to become a CNA. I unfortunately had COVID right in the beginning. So I was able to, shortly thereafter, suit up and go on the COVID unit and be with, the team there. You had people becoming infection control specialists. There was a lot of cross training. I think these are things where until now people stayed in their lane and this is what I do, where now, you see what other people do. There's so much teamwork both within and without. I think we're a company that's definitely forward thinking. We've been operating with telemedicine, remote patient monitoring for quite some time. I think the government, which is hoping we don't have any government folks on the call here, but which could be notoriously a little slower to react to needs, also saw the need for, like we're saying, telemedicine. And I think there's a lot, I think that's just the start. I think a lot of it is to follow and saying, look, at the end of the day, just because it's been like that for so long doesn't mean it needs to be. Let's take a look at what's best for the patient, what's best for communication, and let's try to get this right at this time. And I think that's it's all those things that we're going to come out stronger. Unfortunately, it took COVID to do this, but I think on this side, we're definitely going to come out a stronger healthcare community.
I mean, that's really a terrific attitude. Thank you. And to dovetail, Ryan, I'm super impressed that you're investing in all of these mechanisms to enhance caregiver, resident, and family communication. But while we're on that topic, somebody brought up family visitations, I think, Brian, earlier. I would imagine in your operations, the nurses have had to take on, and the staff, more sort of surrogate family roles because they're with the residents because their families can't visit. Is that an accurate assessment? And how has it affected the teams in the buildings that are taking on this additional emotional sort of responsibility?
And you're on the mark. They do in fact reach out to the caregivers as their family member, and I guess nothing says it more when we have a discharge from the COVID unit. There's a song we play, Here Comes the Sun, and everybody comes down. And of course, all of that patient's caregivers, in addition to family members at the end, all come down. So there's a bond that is very, very strong. And, I try and get to as many of these as I can. And it's heartwarming to see these people getting better and the strength and the teamwork and the love that goes on between our caregivers and the patient and the family.
That's really beautiful. Thank you. And Ryan, how about you in the nursing home environment?
Yeah, so obviously this has been a very difficult time with no visitation and families not being allowed in, and we're all extremely sensitive to that, and loneliness, whether you're in a facility or whether you're at home, has become a greater issue than ever before, unfortunately. And a lot of people were lost to COVID due to loneliness, and it's been very sad and difficult to see. But that's why we did as much as we possibly can to make arrangements for outdoor visitation, to make some sort of as close to in-person visitation as we were allowed to work with, setting up different areas. The summer was obviously a nice little a nice little thing for us because we had the ability to work with the outdoors. Now that it's gotten colder and we're working with more limited space and everything else, it's a little bit harder. But yeah, CNAs, nurses, everyone has had to take on the roles of making sure that the patients feel cared for and loved, and and really spending time with them one-on-one. For patients who had families that were visiting with them every single day, it's heartbreaking that we can't put them together in the same room, but we do the best that we can to put them together virtually so that they can spend as much time as they'd like, seeing each other that way. And if we can do things in person, obviously we do the best we can. Just to allude back to one point before, also obviously PPE has been an issue for all of us involved on this call as well. And I know everyone on this panel has done a good job of making sure that we got in the proper PPE, but that has also obviously had major impacts on everything as well. But yes, we have really stepped up where every single person and every resident we care for, is truly loved, cared, made sure that they're communicated with, and put together with their families, just as if the place was operating normally.
Mhm. Yeah, I happen to know your local leadership teams, and they really rave about the support that your company has provided to the center. So kudos to you. And Ben, what are your thoughts on, please, the additional burden, if you will, or has it been stressful? How would you characterize the additional responsibilities that staff has had with caring for their residents?
Sure, it's definitely been highly stressful. I think we did have the benefit of having multiple buildings in different geographic areas. So when if one building was going through something, we were able to lend support from another building. What surprised me was how everyone really came together. When we had a building in Pennsylvania that had a recent outbreak, they didn't have anything until really 2 months ago, and then we've had director of nursings go from other buildings in New Jersey to go be floor nurses there and really lend support. And so, guys, we've done this. We've been here. I know, from this vantage point, it looks like, there's going to be no end to it. And, the coming together was something that for me was really, just amazing to see. We've obviously, as a company, tried our very best to lend as much support as possible from a morale standpoint. We created an employee gym for them to, we had a takeover of employees work out here. We got them t-shirts. We did, obviously bagels, donuts, whatever we could to really support and show them that we're here for them. I mean, we were there side by side with them, thanking them, but ultimately, it was rough. And like you're saying, becoming a surrogate, you have patients that are normally eating in a dining room. You have patients that are normally in group activities, and that's been curtailed. So now they're taking on, the recreation people are taking on social service roles. The CNAs and the nurses are taking on recreation roles and social service roles. So it hasn't been easy. We've also hired additional patient concierge with the technology to support that, which has been extremely helpful for the families.
That's great. Yeah, I mean, I think if COVID didn't tap into everyone in healthcare's sense of, is this what I want to do? Nothing will, right? I mean, this is a real good time to reaffirm your calling. Okay, to make a somewhat of a left turn here, going back to Trish and Brian, we're now at the thankful point where we're distributing vaccines, but there's some reports that there's, and I guess there was some forecasts that there was some hesitancy. There always is amongst some. Related to taking the COVID vaccine. Trish, you're a nurse. I hope you don't mind me sharing that.
Mm-hmm.
Can you shed some light on the vaccine and maybe something that could, some words that could alleviate those concerns?
Sure, Tim. We are so excited about the vaccine or vaccines here and others that are coming. Clearly the vaccine to stop this virus is our best hope, right? To decrease the spread, to stop this pandemic, and that we're truly responsible for our aging population or our communities in general to really decrease the spread. It is all about the numbers. We think about 24 million people across the country have had COVID. We've had 400,000 deaths across the country. It is about the data. It is about the numbers. I believe from the clinical trial perspective, to look at the efficacy at 94 and 95%, and to remind everyone that tens of thousands of people were participating in those clinical trials. It wasn't done a 10-person clinical trial, tens of thousands, and showed remarkable response to this terrible disease. So I think it is about the numbers. It's continuing to educate our healthcare staff, and particularly our non-clinical healthcare staff. What we've done is had our infection prevention physicians, our ID staff, go down, speak to our departments and our staff who have some concerns, have questions, also to work closely and ask their primary care physician. We have some questions coming from our child bearing age groups, our young nurses who are speaking to their OB physicians. And we actually had a webinar of one of our OB physicians who's actually pregnant herself and telling the benefits and giving the benefits that she felt of why you need to take the vaccine. So I think it's multifaceted. It's ongoing communication, whether formally or informally, to really get the word out and spread the word and to look at the data.
Thank you. Great answer. Brian, your thoughts on gaining more acceptance to the vaccine?
I would echo Trisha's comments. I would emphasize that you have to, again, trust the science, the fact that there is no live virus. So the technology behind this vaccine has been around for a long, long time. Trish mentioned how many thousands of patients had participated before this was rolled out. So it is safe. At St. Clare's, 81% of our staff thus far have been vaccinated, which means that patients can feel safe when they're obtaining care, but that in fact, our staff is looking at this for themselves also to make sure that they're safe. So they are behind what the vaccine stands for. So look at it from the people, the caregivers, the physicians, they in fact are getting that vaccine because I think it is safe and effective.
Great. Okay. And as usual, time is just burning away. So I want to get to a very important topic just to stay on the in the acute care realm. As Trish and Brian, as both of you know, one of the unfortunate results of the COVID pandemic is the hesitancy of older adults, but I think everyone actually to seek out care when they need it, due to fear of potentially contracting the virus and maybe putting off needed wellness visits or even sick visits to their doctor, or avoiding going to the ER, et cetera. Tricia, I'm sure that's something that in your health system, in your hospital, has been a discussion point. Can you shed some light perhaps on some remedies to that?
Sure. We were very concerned, especially the first surge. People were concerned. They were staying in their homes. Again, the data really shows that people really delayed their care, delayed their surgeries. So our option that we've really promoted has been our telehealth, as we discussed earlier, to have access to your provider, to your physician as quickly as possible. We've continued and worked with other associations such as the American Cancer Society in getting that word out. Please come in for your screenings. Please come in for your testing. It is so important to prevent whether it's an expansion or exacerbation of an existing chronic illness, or really stop one from occurring. So it's so many different messages. We've also embraced, as I know all of our colleagues on the panel has, from the CDC's guidelines, the hospitals, the skilled nursing facilities, our rehab facilities are very, very safe. Frankly, probably one of the safest places to go right now, that we've embraced the CDC guidelines, accelerated our cleaning, our processes, to ensuring our infection control processes are in place, and evaluating that. So hospitals, physician practices, skilled nursing facilities are truly safe places to go and be cared for.
Thank you for that. Brian, what are your thoughts on access to care and fear?
I think Trish has adequately covered it, but I will emphasize we have gone through not only St. Clare's, all of the people on the panel, healthcare in particular, extraordinary measures to keep the patients safe, but also to keep our employees and our physicians safe. It's a good time to seek care. And again, from our emergency room and our EMS, we don't want people to withhold care. We're finding again that they're sicker when they come in, and it's a longer stay. So all the things that Trish has outlined, I would emphasize to everybody on this call. People should be seeking care and getting it timely.
And I would imagine for both of your institutions, people can seek out additional information and resources on your respective websites and social media.
Most definitely. Most
Yes,
definitely.
Okay, good.
we have Let's Talk Health. I would recommend people, if they want to get a quick 15-minute segment, either in terms of the disease or behavioral health issues, that's a good place to start.
Mhm. We also had community conversations to offer as well too, from our providers, physician leaders as well too, and continuing to educate everyone.
Okay, great. Okay, so the final, before we get to questions, the final question I have for everyone, and maybe Ryan, if you'd be kind enough, we can start with you. My question is, as healthcare leaders in the Morris County community, can you summarize what issues and concerns are most pressing to you as it relates to meeting the healthcare needs in the community? Ryan, would you mind taking this first?
Sure. So right now, it's a very similar answer to what my colleagues just said, which is that we really need to regain the trust of the patients and of the community. They're very scared to leave their homes and get infected, and stay masked at all times and proper hand washing. But we need people to trust the system, because if they don't, they're coming in, as Brian said, they're coming in sicker. They're coming in where it's too late. And right now we're just trying to make the community have the confidence that with the vaccine that we have here, we're trying currently to get testing centers, more and more COVID testing centers opened up. We're trying to get one opened up at our property currently. We also have been working very hard with different programs to get people more comfortable rejoining the system. So we've been doing a lot more focusing on like respite care, where if someone's been taking care of their loved ones, since everyone has been sent home to work remotely for the most part, and that's why a lot of people have not been receiving the care that they need, because their loved ones are at home and have someone that's there 24 hours a day to take care of them. Well, if the spike ever goes down and the virus gets under control and people can start getting out a little bit more, we're doing more respite care stays that people need 24, 48 hours, that their parents need just a little bit of time. Somebody's going in for a procedure, requires some sort of, testing prep. Whatever it is, we're offering, services as short as 24 hours to, whatever stay length people want, to come in, get a feel for what the facility is like and what the healthcare system's like. And they could also come in and get vaccinated if they do that, which would be a nice benefit as well. So
I love that. That's amazing. Thank you. Ben, what are your concerns as we move forward, or things that you're thinking about?
Yes, I think, like my colleagues have said, I think getting information out there is going to be, the most important thing for all of us. Like vaccination, which anytime that, if you look at the history over centuries, anytime there has been a vaccination, there's always been the anti-vaxxers or the skeptics. And as science proves itself and people get more comfortable, I think the same thing will be said for our setting. Like my colleagues have said, I believe our settings are probably, from the safest places out there, where everyone's having vaccines. I know we have many private rooms. Everyone's wearing protective equipment. So really, it's a matter of, recognizing that and addressing your needs. Studies will be coming out at how many people died because of COVID while not having COVID. And I think, you'll see people showing up with a stage 4 cancer versus, an earlier stage where they could have, taken care of it earlier. And I think these are things in retrospect that people unfortunately are going to regret, but the more we could get the message out there and more we can inform the public that, if we're seeing non-electives go down now, it's hard to say that that's just that things that has changed. Rather, people are living with the condition and not addressing it in real time. And I think we're going to see the shift in healthcare where, home care is probably going to pick up, but our settings in the skilled nursing are becoming more mini hospitals, and that trend will continue. I think we have to adapt accordingly, and I think the public has to see us as a critical need.
I have to say, just anecdotally, in the past week, I've been helping friends and family members with 3 different situations with elderly loved ones where probably if they had access, just what you said, Ben, care sooner, one was a bad fall, one was a potential stroke, et cetera, et cetera. So I think we're starting to see some of those emergent situations taking form, coming to fruition due to people's fear of not accessing care. So that's a really important message. Thank you. Okay, so we probably do another hour. There's a lot of questions, so I'd like to pick a couple of them. Laura Giros had a question, and this is for anyone. What kind of support, what what kind of support are you offering employees to address the emotional toll this is taking on our industry? I mean, this touches to some of the information we probably answered before. Any additional thoughts on counseling or support for staff that anybody would like to answer?
We rely on our wellness and recovery, both for the patients in the community and the employees we serve. So it's an outpatient service. And what was interesting is that during the pandemic in the spring and now, we have seen people who are concerned about coming in. It was the behavioral health that volume has stayed at or above what we had expected. So wellness and recovery provides that support for everyone.
Mm-hmm. In addition to the wellness support as well too, we do have a COVID fund that's been set up in our community. Many of our staff are extremely stressed based on the living situation or their loved one being out of work. So if they have any financial need, all they have to do is apply for it. It is unanimous. And really how we can support them in so many ways of their life beyond the hospital as well too. It's, as we all know, it's very stressful out there. So we need to continue to support our community. So that's been another positive avenue for our staff.
Okay, wonderful. Tim Ford from Einhorn Lawyers had a question about, I guess this is for everyone. Essentially, are you folks monitoring the adoption of the vaccine amongst your staff, and is that something that is an ongoing sort of metric that you're tracking with your teams?
Absolutely.
Yeah, I would imagine.
Again,
Okay.
81%, and we're looking at people who've had employees that have had COVID, so they are at a 90-day window. So we're looking at everyone that is employed in our positions. And actually we're running, as we're speaking now, we have our second injection vaccine clinic. So we run them regularly and we are watching.
Mm-hmm.
Okay, great. Folks, I'm getting the cutoff signal from Wendy. But thank you all, it was amazing. And again, we could probably do another hour. And thank you so much again for all that you're doing and your respective organizations and teams.
Yes, thank you, Tim. Thank you, everybody. I know you guys are so extremely busy and we were really grateful to have you for this hour. It is recorded. We will share it. It was out on Facebook. We'll have that recording. I know we did have a question on bereavement support. There will be a webinar involved, just dealing with, the death and that first year and all that. So that will, Mara asked that question. So we will address that. And I'm really looking forward to, you can hold the date for February 23rd at noontime. Details will be sent out soon. So that'll be our next panel of clinicians. And yeah, thank you to our healthcare heroes. I consider all of you my healthcare heroes and everybody that works for you in your organizations. We can't thank you enough for all you do to keep us safe. And I think knowledge is really is what we need to do. People need to be educated and informed. So thank you. Thank you from the Morris County Chamber. Thank you, Tim, for moderating. And I hope everybody has a fantastic rest of the week.